Let's pretend for a second that you're Homer Simpson and you just got hit by a radiation energy. What's going to be the first cell that's affected? And you might think, okay, it's going to be the one closest to the blast. It's going to be the skin. However, in this particular instance, the correct answer is going to be your intestinal crypt cells. Why? Well, the reason why is because ionizing radiation induces DNA damage. That's a double strand breakage, and it causes free radical generation, and that will affect highly proliferating cells like your stem cells, your hematogenous progenitors, your intestinal crypt cells. These are rapidly dividing, and so they're going to be the first ones to experience the fallout after the radiation exposure. And that's why people lose their hair after they have the radiation uh, treatments, because those follicles are going to be rapidly proliferating. So you'll have pancytopenia, diarrhea, vomiting, hair loss, desquamation of the keratinocytes. And so here's a little practice question here. Not Homer Simpson anymore, but here's our 40-year-old woman exposed to high dose gamma radiation. Within days, she's got nausea, vomiting, weight, and severe watery diarrhea. What explains this is the rapid turnover of the intestinal epithelium. So this question is just going to give you a series of different cell types, and they'll say which one essentially proliferates most rapidly. Skin cells are affected, but not as rapidly as those intestinal stem cells, which have extremely quick turnover. You'll have DNA damage that results in the upregulation of p53, and that will inhibit the replication and induce apoptosis of your affected cells. And so ionizing radiation can vary, and the highly proliferative cells have less time to repair that radiation induced damage before the cell death actually occurs. And so intestinal crypt cells dividing continuously are going to produce more cells which have a short lifespan and are going to be renewed every 3 to 5 days. And so you should also look out for other cells like bone marrow, gonads, skin. This can cause hematopoietic progenitor problems like pancytopenia. If it's in the gonads, it can cause infertility, spermatogonia. And if it's the skin, you can have desquamation and hair loss. So skin is a pretty good answer, but intestinal is just a bit quicker. Cardiac, this is going to be long-lived, low turnover, so resistant to radiation. Renal, bladder, this is going to be moderate, so not too bad, not first hit. And type 2 pneumocytes can divide whenever they need, not rapidly dividing in their baseline. Okay, so that's a fun little question about your radiation and how it affects the body.